Hi, Miss Abby. How are you today?
Good.
That's good. My name is Essence, and I'm going to be your nurse today from 7 a.m. to 3 p.m. And I just want to make sure that I give you your lactated ringers today, okay? First, let me put my name on the board. Essence. And now, Miss Abby, can you give me your first and last name? I want to make sure that I have the correct patient.
Abby Corlo,
Okay, now how old are you?
25.
Alrighty. Do you have any known allergies, Miss Abby?
No.
Okay, your MRN number is 7852-361. 7852-361. Alrighty. Your bed is locked. It is in the lowest position. Your call light is here. Your 3 side rails are up. Your floor is clutter free. And you do have your bedside table. Alrighty, Miss Abby. So, per provider's orders, I see right here that you are due for your lactated ringers via IV at 125 milliliters an hour. So, first, Miss Abby, I'm going to make sure that I also check with the MAR. Our third med check. Your lactated ringers are basically fluid to make sure that you are constantly staying hydrated, okay? Alright, so now I'm gonna get my medicine and I'm gonna confirm that I do have Miss Abby Carlon, who is 25 years old. She is getting lactated ringers, 150 milligrams, 125 milligrams an hour, continuous via IV right now at 2 o'clock. The expiration date for the medication is February 2028. Alrighty. So I have the correct patient, which is Abby Carlon, the correct medication, which is lactated ringers, correct dose, which is 125 milliliters per hour. Correct route, which is IV, a continuous flow, correct time, which is now at 2 o'clock, and the correct expiration date, which is February 2028. Alrighty, so now let me click on it. Oh, wow. So let me make sure I scan my patient bracelet. The medication, which is the lactated ringers. Alrighty, the red button has turned green. Okay. Alright, so now I'm gonna sit this there, and now I'm gonna take out my bag. And I'm going to repeat my expiration date. I have the lactated ringers that expires February 2028. I'm looking at my bag to make sure that all liquid is clear, that there's no tears inside the bag, so everything is very potent. I'm going to take my tubing out of the bag, and I'm going to look at my tubing to make sure that there are no holes in my tubing. Alrighty. And now I'm gonna aseptically spike my bag without touching the tip of the spike. I'm gonna insert the spike and then you just hang it right quick. Alrighty, and I do have my roller clamp closed. Okay. And now I'm just gonna prime the bag, the tubing. I'm gonna squeeze the drip chamber. And I'm gonna prime the tubing. have running water everywhere. Alright, I have primed my tubing. So now I'm gonna recap it. And I'm gonna close my roller clamp. Alright, I'm gonna just lay this right here since it has been closed. Okay. So now I'm gonna set up my pump. I'm gonna insert, I'm gonna insert the tubing now. Oh, I did that the wrong way. Insert the tubing right here. Now, oh, well, let me make sure that I don't have any air bubbles before okay, so yes, I do not have any air bubbles in my tube. Okay, now I can carefully insert the tube inside the machine. Okay, I'm gonna close the door, and now I'm gonna set the primary 125. Volume to be infused is 500. Alrighty, now let me put my gloves on so I can check your IV site before I plug your tube in. So, Miss Abby, I'm looking at your IV site, and I want to make sure that you don't have any pain right here. There's no old or dry blood, and let me know if there's any tenderness, okay? Do you feel any tenderness?
No.
Okay, that's good. Alrighty, so now let me get my alcohol swab, and I'm going to clean this port for 15 seconds. I'm going to take this cap off. I'm going to insert that. Alrighty. So now I'm going to start the pump, and I'm going to unclamp my roller clamp. And now everything is infusing. So everything is now flowing. I see that it's dripping. I'm going to stick my label up here. Alrighty. So we can change it in the correct amount of time. All right, Miss Abby, thanks so much for allowing me to do your primary pump. And just let me know if you need anything. I'm gonna wash my hands. I'm making a mess in your room. Let me clean that up. So I'm gonna wash my hands, and I'm gonna make sure that your bed is locked. It's at the lowest position. Your side table is here. You do have your call light. Your floor is clutter free, and your 3 side rails are up. And I'm gonna throw this in the trash, okay? Thank you so much, Miss Abby. And if you need anything, just call me on your call light, okay?
Okay.
All